So if you're one of the, billions of people who suffer from allergies, you know it's way more than just a seasonal thing. But what if I told you the future of treating it has less to do with new pills and, well, more to do with your smartphone and the planet? Sounds kind of out there, right? But a fascinating new paper suggests we're on the verge of this huge revolution in allergy care, and it's all being driven by tech and a surprising link to environmental sustainability. Let's dive in and break it down. Okay, so first, let's just wrap our heads around the sheer scale of this. That number you see, that's the percentage of the entire world dealing with some kind of allergic disease. We're talking up to 30%. That's not millions, folks, that's billions of people. And this isn't some static problem, it's a full-blown global health issue. And honestly, it's getting worse. So how in the world do you tackle a problem that big? Well, the answer is coming from some really unexpected places. We're talking about a fusion of medicine, data science, and, believe it or not, environmental science. Why? Because it turns out the very tools we use every day to manage allergies, they have a pretty significant and mostly hidden environmental footprint. Which brings us to our first big topic, healthcare's hidden footprint. And yeah, this is a startling fact. Healthcare itself, the whole industry, has a major carbon footprint. As a sector, it's responsible for up to 10% of global greenhouse gas emissions. I mean, that's huge. And a surprisingly big chunk of that comes from one of the most common medical devices in the world. So let me ask you a question that's probably gonna sound a little strange. Have you ever, even once, thought about the carbon footprint of your asthma inhaler? I'm gonna guess the answer for pretty much everyone is no. But as we're about to see, the impact, it's absolutely staggering. All right, take a look at this. This slide shows the two main types of inhalers, and the difference is, wow, it's dramatic. On the left, you've got the common meter dose inhaler, or PMDI, you know, the one that puffs. It works like a tiny aerosol can, and it uses a propellant gas that's actually a really powerful greenhouse gas. But on the right, you have the dry powder inhaler, or DPI. It's powder-based, and its environmental impact is just a tiny fraction of the other one. Let me be super clear here. For the exact same medical benefit, the PMDI can have nearly 300 times the carbon footprint. 300! It's wild! And to really put that into perspective, look at this number, 420 kilograms of CO2 equivalent. You know what that is? That's the average annual carbon savings if just one person switches from a PMDI to a DPI. For context, that's about the same saving as switching your car from a regular gas guzzler to a hybrid for a whole year. From one little inhaler, that's a huge impact. And this leads to what is maybe the most important insight in this whole section. What's good for the patient is also good for the planet. They go hand in hand. A major study found that poorly controlled asthma, where you need more emergency inhaler use, more doctor visits, it generates a carbon footprint 3 times higher than well-managed asthma. The takeaway couldn't be clearer. The most sustainable treatment is the one that actually works the best. Okay, so if better control is the goal, how do we get there? This brings us to the first part of the solution, this digital revolution that is fundamentally changing how we manage allergies. It's making care more precise and more proactive than it has ever been before. We've got this whole new toolkit emerging. We're talking about telemedicine, so you can see a specialist right from your living room. We've got artificial intelligence, AI, that can analyze data to predict an asthma attack before it even happens. Your phone, it becomes a health coach with mHealth apps to track your symptoms. And then there are these smart IoT devices, like connected inhalers, that can give your doctor real-time feedback on how you're doing. It's a whole new world.
And hey, this isn't just some sci-fi theory. This stuff is already delivering real results. Just look at these examples from around the world. In Russia, an app for atopic dermatitis actually improved patient outcomes. Over in Europe, a device called a wheeze scan was more accurate at detecting wheezing than parents were. And in Turkey, virtual care led to way better asthma control in kids. These tools are making a real, tangible difference right now.
The paper puts it perfectly. This whole digital shift isn't just about making things more convenient. It's about getting better health for patients, while at the same time making the entire system work more efficiently for everyone involved. So, this digital revolution doesn't just improve our health outcomes, it also paves the way for the second part of the solution, making smarter, more sustainable choices that benefit both us, the patient, and the planet. The paper lays out this really simple 4-step path to greener care, and it all starts with just getting the basics right. Better treatment means less waste. Simple as that.
Then it's about making a conscious choice to prescribe those lower carbon inhalers whenever it's clinically appropriate. From there, it's about responsible disposal and recycling. And finally, using tech like telemedicine to cut way down on the travel emissions that come with all those in-person doctor's visits.
But here's the thing, there's a huge disconnect. As this data shows, most patients, 65%, are completely unaware of this issue. And almost half of prescribers don't feel confident even talking about greener options. But, and this is the crucial part, a big majority of patients, 60%, are totally willing to switch to a greener option if they knew about it. The desire is there, the information just isn't getting through. So, the key here is bridging that gap. This isn't about forcing choices on people, not at all. It's about creating a partnership. It's about giving both doctors and patients the information they need to make the best decision for their health and for the environment, together. But, individual choices and cool new technologies are only part of the story. To really make a difference, these ideas have to be scaled up into a global action plan, one that addresses the massive inequalities in allergy care that exist all over the world today. And the inequality shown on this slide is it's staggering. It shows the massive disparity in who can actually see a specialist. In Europe, there's roughly one allergist for every 50,000 people. Okay. In Hong Kong, it's one for every 1.46 million. That's a gap that technology is uniquely positioned to help solve. And this is exactly where that digital revolution we talked about becomes such a powerful force for equity. Things like telemedicine and mobile health apps can bridge these huge distances, connecting patients in underserved areas to the kind of specialist expertise that would otherwise be totally impossible for them to access. This all builds towards this really powerful idea called the One Health approach, and it's a philosophy that gets it. You just can't separate human health from the health of our planet. Our personal well-being is intrinsically deeply linked to our environment, and our healthcare choices really need to start reflecting that. So the paper's final call to action is, it's ambitious. It's about creating a unified global approach, one where we track allergy trends together, make sure everyone has access to the best digital tools, and actually bake sustainability into the very definition of what good medical care is. Ultimately, this is the vision we're aiming for, a future where your allergy care is personalized, tailored specifically to you. It's informed by real-time data. It's delivered in a way that protects our planet, and it connects you to the best possible care, no matter where on Earth you live. Which leaves us with one final thought to chew on. As technology and sustainability keep merging like this, the very nature of healthcare is being redefined right before our eyes. So the real question isn't if this is going to happen, but how quickly can we all adapt? It's a future where our personal health and the health of our planet are finally and rightly treated as one.